leads me to another topic that we want to address. Sometimes it's difficult for certain people groups to necessarily know, first of all, what nutrients and what food items are good for them. And second of all, how do they access those? Well, in the news this last week, and actually the week before, we've seen something that has caused great consternation to many of us. And it seems to be the racial disparity of certain ethnic groups, particularly in the two of the cities hit hardest by COVID-19, that being New Orleans and New York. What we saw is minorities, particularly Hispanics and African Americans, which make up less than 30% of the population, actually accounted for more than 70% of the mortality. So we want to look at that a little closer. We want to find out what is potentially aggravating the racial disparity. Clearly, it's come to the forefront with COVID-19. We want to look at that closer, and I want to invite again my colleague, Dr. Zeno Charles-Marcel. Dr. Zeno is an internal medicine specialist. He's also an adjunct professor at Loma Linda University and very abreast with lifestyle principles, particularly nutrition and exercise. And how do they relate to this current issue of racial disparity in COVID-19 death rates? Dr. Zeno.
Thank you, Leila. Well, first of all, we need to realize that everyone who is affected is affected. Now, that might sound as if I'm just playing with words, but to the person who is in the intensive care unit, their race is not the major issue. The thing is, they're fighting for their life. So the idea of looking at race, we have to look at the medical sociology of this. On April 15, Tax Day, this was an article that was published in the JAMA network, COVID-19 and African Americans. Now, what was going on? They were looking at people all around the country for the data that they were able to collect from the CDC and from Chicago. In this particular case, African Americans were hit hard by coronavirus, they said. 33% of those hospitalized are African Americans. 13% of the US population is African American. 68% of the coronavirus deaths, however, were in Chicago, were African Americans. So look at that, 13% of the population, 68% of the deaths. 50% more likely to have heart disease than white people, 40% more likely to die at an early age of any cause, 19% could not afford to see a doctor. Were these the things that were playing a part in what was going on? Well, the Wall Street Journal had shown before all of this that if we were to look at the overall death rate and look at the age distribution, we'd see that the older one was, the more likely they were to die of, or to get the coronavirus and to die from the coronavirus. And if you look by condition, which is on the right side of the screen, looking at the cardiovascular disease, diabetes, etc., you would see that they were overrepresented as well. People with these diseases died more frequently than others. So one might say, is this what was going on with the minority population, especially the Blacks? Well, from the Kaiser Foundation, they looked at this report looking at selected health condition by race and ethnicity in 2018. And what you see, the top level is where whites are. On the left, this is asthma. In the middle, that they have diabetes, and the right, heart disease. And you can see the distribution there. And you can see that certainly for asthma and for diabetes, that except for the Asian population and the Hawaiians, the Native Hawaiians and the Pacific Islanders, most of these were above the incidence and prevalence for whites. Then this came out in Arizona, health disparities increase the impact of COVID-19 on communities of color. Indigenous people make up 21% of Arizona's COVID-19 deaths, but only 5.3% of the state's population. So this is not just an issue with Blacks. It's an issue of certain kinds of people. This was a very interesting picture in that article, different access to healthcare, and you'd see that the red on the left has almost direct access, then the yellow had a little circuitous route to get to the access, and the blue on the right, very difficult to access the healthcare. So different groups of people may have different ways of accessing healthcare, but was it just an issue of access? This is looking at barriers to accessing. And we can see here a distribution, again, that would tell us that people of Hispanic, Asian, etc. Ethnicity had a more difficult time in getting to see the doctor, or delaying their health care, or using the emergency room as their usual source of health care. The Kaiser Foundation also published this on April 7th. Communities of color are higher risk for health and economic challenges during COVID-19. And what they looked at was the population and the percentages of people who were below the poverty line by race and ethnicity. Whites were 10%, Asian 10%, all the others were above. So was it just then an issue of finances, poverty? Well, let's go across the waters to England. England started to collect, or the UK started to collect data looking at their populations. And what they found was that if you look at whites, Asians, and Blacks, that there was a disproportionate amount of deaths associated with COVID-19 in Blacks, and just about equal in Asians, and lower, if you were, in whites. So there were, for the small amount of people who were Black who were attended to with COVID, a greater proportion of those were dying from the infection. So here are some facts. COVID-19 is an egalitarian disease that can affect anyone and everyone if it comes in contact and you're susceptible. It impacts some groups more than others because of existing inequalities. This is part of the issue. People of color and other minorities in low socioeconomic categories are more likely to be exposed to COVID-19 for a variety of reasons, including the kinds of jobs that they do, and the kind of income they have, and the kind of transportation that they'll need. And these things are part of the life and the fabric of the society. Groups of color may also be more likely than whites to report other healthcare barriers to access. And people of color are more likely to live in locations and housing situations that put them at increased risk of infection from coronavirus, and of course, the pollution issues. In Chicago, more than 50% of the COVID cases and nearly 70% of the COVID deaths were involved in Black individuals, even though they make up only 30% of the population, as Leila pointed out at the beginning of this segment. Death was concentrated mostly in 5 neighborhoods in the city's south side, which is primarily an ethnic minority portion of town. In Louisiana, 70.5% of deaths have occurred among Black persons, who represent only 32.2% of that state's population. In Michigan, 33% of COVID-19 cases and 40% of deaths have occurred among Black individuals, but they represent only 14% of the population. And if we look in New York, what we see is that Blacks and Hispanics have accounted for 28 and 34% of deaths, respectively, while they represent in the population 22% and 29%, respectively. So the data are there. Whether in the US or the UK, regardless of the state that we look at, if they have collected the data, many of the same issues apply. The virus is not racist. People can be racist, systems can be racist, but the problems are bigger even than race. And let me point out from this particular model that was presented for cancers by Freeman and Chu back in 2005. social injustice, poverty, and culture, all of them working together influence what is going to happen with the health status and the finding of disease, the accessibility of treatment, even which treatments will be provided, and what will happen after recovery. Now, in the right corner, I have adjusted this slide to include a few things, and that includes the isms. When we talk about social injustice, we're not talking just about race. We're talking about gender and religion and tribe and caste and ethnicity and ability. People with differing abilities are discriminated against. Geography, what part of the country, what part of the world you come from, your language. If you're in a majority language group, you may have one set of things applying to you. And if you're not, you might be a socially outcast. Social class, education, bloodline, age, all of these things can affect the social justice and also affect the culture, and therefore also affect whether or not one is going to be poor. And these things affect then the chronic disease status and the disease resilience that the person can have. And therefore, these things, complex network of factors, will then produce problems with prevention, early detection, diagnosis, incidence, treatment, and survival and mortality associated with any kind of disease. We need to remember that there are social determinants of disease. If you look on the top of this particular slide, 40% have to do with socioeconomic factors, 10% have to do with the physical environment, which means that for the most part, if someone cannot have access to changing this situation, 50% of what determines somebody's health may not be within their grasp to be able to change. But I don't want to focus on that. I want to focus on the 30%, the health behaviors that they can change. And if we were to focus on this, then we can have a fighting chance for people to be able to do better. So another way to label this talk, we can say it is how to stay alive. And here, first, I want to talk to the health professionals. We need to know that there are vulnerable populations. And because of our oaths that we have taken as healthcare providers, right, we have a duty to warn people because their lives may depend on how we warn and if we warn them about what it is. We need to get in touch with our patients. In our hospitals, we need to talk to patients and workers. If we see people who are vulnerable, but they're not practicing what they should be, we should be able to help them along with it. In our social circles, in our social media, in the parking lot, in the supermarket, we should identify ourselves as healthcare workers. By the way, that's a badge of honor. And we should say, sir, ma'am, please put on your protective barrier. Please wash your hands or whatever it is. And we should encourage people. Honey is much more attractive than vinegar. And so we don't have to scream at them. We don't have to shout at them. We just need to help them to see that this is something that can save their life and save the lives of their families, friends, and the community. People of color and all vulnerable populations need to realize this, that your life is on the line in this particular case, but not just because of this. But we must be sober and be vigilant and not panic. We should do the basics as if our life depends on it, and in some cases, it actually does. And you should be the world's best hand washers, the world's most careful when coming in contact with people, the most diligent users of PPE. And yes, there are mask issues. There are reports of Black youth being harassed by security forces because they don't know whether this Black person is going to rob the place. These are social inequities, and these things exist, but it doesn't mean that you have to take your mask off, all right? Be insistent that others wear PPE around you when they come to your house to do something, that they're wearing the protective barrier, because this may affect everyone in that household. Yes, there are socioeconomic factors and social factors and physical factors. Some of these things are modifiable, some are not modifiable. But even though we can change laws, we usually cannot change attitudes. Even though we can change behavior, we cannot change the heart. And of all of the behaviors and hearts to change, ours, it starts with us, with me. Behavior is paramount in this particular case and for any kind of infectious disease or pandemic. And of course, One should be taking care of his or her own health. We should take some responsibility of taking care of our own health, regardless of our circumstances, even though there are things that we cannot change. The things that we can change, those are the things that we should do by God's grace. So we should stop the spread of germs. We've seen this before. Everybody has seen this before. We can help to stop the spread of COVID-19 by doing some simple things. What else? There are some special things that we have talked about in all of these. Don't smoke, for instance. Diet that's high in fruits and vegetables, adequate sleep, taking steps to avoid the infection, manage our stress, exercise regularly, and take steps to avoid, take steps to avoid the infection, and of course, managing our weight. These are things that we can do. We also know that smoking upregulates angiotensin II converting enzyme receptors, and this therefore can make smokers even more vulnerable. So if you don't smoke, don't start. And if you smoke, get some help and stop. Some physical things that we can do: sleep 7 to 8 hours a day. We can learn to do this, even though we might want to stay up and burn the midnight oil and watch that extra Netflix or whatever movie. Get some sleep. Moderate exercise. We can go for it and do it an hour a day. Eat fruits and vegetables, seeds and nuts, as Dr. Nedley was talking about. We can learn how to like them. We may not like them at first, but we can eat them, and over time we will learn how to like it. This we're talking about not just our health, which is very important. We're talking about our life, because we can die if we end up getting this, and we're in a vulnerable population, and then we end up having to go to the intensive care unit. This is not good. Avoid nicotine and alcohol. And come on, we can get help to get these under control. And for our chronic diseases, it's about time that we take seriously the diabetes, the hypertension, the coronary artery disease, etc., and do what needs to be done. These are usually reversible conditions if they are dealt with early enough, and they can be done with lifestyle changes. And we should help and encourage others, and we should protect our homes. Therefore, we should be models at home. Our mental and emotional state, we should stay positive and be optimistic. We should cultivate an attitude of gratitude and manage stress healthily. We shouldn't panic. We shouldn't worry about all the political situations that might be going on, because our lives do not depend on those. They depend on what we do. Our spiritual life is also important. We should consider the transcendent, find meaning, and yes, we should even pray, because there is a God in the universe who loves us. Socially, we should stay connected. We should avoid loneliness, and we should be a positive influence wherever we are. And it doesn't matter what stage or what part of life we're in. In Nebraska, they put out this particular idea. Advocates, they hope churches can help mitigate the COVID-19 racial disparities. Unfortunately, across the United States and in other parts of the world too, sometimes the church-going day, Sunday morning, might be the most racially divided time in the week. I think it's high time that churchgoers and churches get on the ball and work in this direction so that everyone can enjoy the best of health and no one has to be in that special vulnerable group. But there's a story behind the myth that happened with Blacks early in the course of the COVID-19 epidemic. There were rumors that people with dark skin may be immune to COVID-19, and these were circulating in social media since late January, and people believed it. And it was spread among the social media groups. People actually were believing that because of black skin or dark skin, one did not have risk. And therefore, people who believed this did not take into account the fact that they were believing a lie. I tell you, what we think and what we believe can make a difference as to whether we're going to live or die. Because when we get incorrect information and we have an incorrect belief, we may act in such a way that we can put our lives and those of our families and our friends at risk. The immunity myth has also been widely circulated online in the African American community, where it was featured in memes and in viral jokes, and people were actually laughing at this. I tell you, this is nothing to be laughed at. COVID-19 will kill you if it can. It's not the worst thing that has ever happened, but this virus is not racial. It is an equal opportunity killer. So the best idea is to stay alive. Do the things that we know, do the things that we can do, and leave the rest to God.